Welcome to the Western Ohio PBIS Network podcast. My name is Brandy Stiegel. You are watching video 2 of the two-part video series that is focusing on using the Tier Fidelity Inventory, or the TFI, to measure the fidelity of your school-wide PBIS implementation. This video will focus on administering the Tier 2 Tier Fidelity Inventory that will be used to measure your Tier 2 implementation and those supports. After this video, you will understand the features of the Tier 2 TFI. You will understand each of the items in the Tier 2 TFI to assist your teams in using that TFI. You will understand the best practices that allow Tier 2 teams to integrate mental health practices into their PBIS framework. The Tier 2 TFI is divided into 3 subscales. Those subscales are teams, interventions, and evaluations. The first subscale is going to focus on teams, that Tier 2 team. The first item, 2.1, is looking at the team composition. The second item, 2.2, is looking at the team operating procedures. The third item, 2.3, is looking at screening. And then item 2.4 is looking at that process for requesting assistance. The next subscale is that implementation, looking at that overall implementation of the Tier 2 supports. So item 2.5 is looking at those options for Tier 2. Item 2.6 is looking at those Tier 2 critical features that should be in place. Item 2.7 is looking at practices matched to student need. Item 2.8 is looking at those how students have access to Tier 1 supports. And item 2.9 is looking at the professional development that has been planned for the student personnel. The third subscale is evaluation. This is going to be looking at how that team is using and collecting data to drive their decisions. Item 2.10 is going to be looking at the level of use. 2.11 is going to be looking at student performance data. 2.12 is looking at fidelity data. And then 2.13 is looking at that annual evaluation. So before we get started, I want to talk a little bit about mental health. And so throughout this presentation and this video, you will hear me discuss ways to integrate mental health into your PBIS framework. So data from the World Health Organization indicates that mental health challenges affect approximately 400 million people worldwide. Roughly one person out of every 4 will eventually develop a mental health or a behavioral health challenge within their lifetime. Individuals who experience these conditions are at greater risk for a number of social and economic challenges that include things such as reduced access to health care, social services, emergency relief, educational opportunities, and other things. They also face restricted employment and income. They face stigma. They face potential discrimination. They're more at risk for violence, abuse, and at risk for further disability and premature death. Given the prevalence rates of mental health disorders among adult populations, it's not very surprising that there are a large number of children and youth who are also affected by social, emotional, and these behavioral health challenges. Surveys conducted in the United States have indicated approximately 1 in every 3 or 4 children experience disorders, and 1 in 10 is identified with a serious emotional disturbance to the extent that their functioning is impaired. When these behavioral or mental health issues are left untreated, these challenges may increase in intensity and severity, which can result in persistent negative outcomes as children and youth emerge into adulthood. Data was collected from a nationally representative sample of more than 10,000 youth ages 13 to 18 years old and from their parents. Results showed that 31.9% of those that were surveyed were diagnosed with an anxiety disorder. 19.1% of those surveyed were diagnosed with a behavioral disorder, and 14.3% of those students were diagnosed with mood disorders. Roughly 40% of those that responded met criteria for having more than one of those disorders that we just listed. In addition, the median age of onset occurred differently according to that disorder. So let's kind of go over that. Anxiety disorders began emerging at 6 years of age, followed by behavioral disorders, which began to onset around 11 years of age. Mood disorders began onset at about 13 years of age, and substance disorders began to onset at about 15 years of age. Among preschool and young school age children, symptoms that emerge prior to diagnosis of disorder are often described using those broader terms of internalizing or emotional behaviors and externalizing or behavioral problems. Evidence has indicated that internalizing and externalizing problems are commonly experienced during early childhood. As many as 15% of young children ages 18 months to 5 years of age, and approximately 1 in 7 school age children are affected by these externalizing and internalizing behaviors. Effective intervention can reduce the risk and intensity and impact of these behaviors, but many children and youth who experience mild to severe problems, either internalizing or externalizing, are often inadequately supported. They are delayed in accessing services, or sometimes they receive no treatment at all. For the few children who do receive social, emotional, and/or behavioral supports, their schools are typically the primary provider of these supports. In fact, schools play an essential role in the lives of children, and they offer a natural context or setting for students to access the delivery of preventive and early intervention services. Implementing a PBIS framework can ensure that children who need additional support are identified and have access to effective interventions. Throughout this training, we will discuss ways to integrate mental health supports within that Tier 2 PBIS framework. So let's go ahead and jump into the items. So item 2.1 is going to look at team composition. The feature for this item says that Tier 2 or the combined Tier 2 and Tier 3 team includes a Tier 2 systems coordinator, an individual able to provide 1, applied behavioral expertise, 2, administrative authority, 3, knowledge of students, and 4, knowledge about the operations of the school across grade levels and programs. So some sample data sources include your school organizational chart or the Tier 2 team minutes. Now, a team gets a 0 if the Tier 2 team does not include a coordinator or 4 core areas of Tier 2 team expertise that's listed in the feature. A team will receive a 1 if the team is identified but without a coordinator and all 4 core areas of Tier 2 team expertise, or attendance of these members is below 80%. A team will receive a 2 if the Tier 2 team is composed of a coordinator and individuals with all 4 areas of expertise, with attendance of these members at or above 80%. So some guiding questions to think about when it comes to the Tier 2 2.1 is, do we have an adequate number of members on the Tier 2 team? So a Tier 2 team does not need to be large. It can consist of 2 to 5 people. And then you want to think about, does the team include someone with the authority to make decisions and someone with behavioral expertise to coordinate interventions? Now, if you do not, if your Tier 1 team and your Tier 2 team have to serve together, or there's just those teams are just one team, you don't have a separate Tier 1 and a separate Tier 2 teams, you need to think about how we will meet separately to discuss our Tier 1 implementation needs and our Tier 2 implementation needs. So 2.2 is going to be looking at team operating procedures. This feature says that the Tier 2 team meets at least monthly and has a regular meeting format and agenda. They include minutes, they have defined roles, and they also have a current action plan. So some possible data sources include the Tier 2 team meeting agendas and minutes, the Tier 2 meeting role descriptions, and the Tier 2 action plan. A team gets a 0 if the description of the feature is not being implemented. If they get a 1 if the description of the feature is being partially implemented, and they get a 2 if the description of the feature is being fully implemented. So again, as we said in the first video, it's very important to keep your artifacts organized and in a place that's accessible. Remember that there are tons of templates that are available out there on the web that will allow you to organize your team meeting minutes, your agendas. And there's also in your tier 2 training, which you should have received, a role sheet where teams can assign roles to individuals so that they can operate more efficiently. So some tier 2 operating procedure considerations. One is the tier 2 team separate from the tier 1 team. So the tier 2 team may be a part of a tier 1 team, but a regular meeting should be scheduled to review that tier 2 data that is separate from that tier 1 meeting. Does the team have regular monthly meetings? Has the team established a meeting format, and do they consistently follow that meeting format? Are minutes taken during the meetings? Are participant roles clearly defined? Is a team following the current school year's action plan? So some things to think about and ways to integrate mental health. Here are some strategies. Number one, the tier 2 team includes community employed and school employed staff with mental health expertise. Teams also should include families and students as active leaders. Another mental health integration strategy is that the tier 2 team includes those who have the authority to allocate resources, develop policies, and commit to necessary and critical changes in how both school and community employed personnel function at the school and the student level, i.e., those school based clinicians, any of those people that serve in that role or that capacity. A team should review community and school data to inform decisions regarding which evidence-based interventions are selected along the continuum of tier 2 support so that these things are aligned and that we understand who we are serving and the needs of those communities and those populations that we're serving. Teams should review tier 2 roles and utilization of school and community employed clinicians and community partners roles and they should be clearly defined through a memorandum of understanding. So we know that in a lot of our school districts, many school districts, there are multiple community health partners that are working within that school building or that school district. So there should be some coordination of those roles, and that coordination should be clearly defined, and those roles should be clearly defined through a memorandum of understanding. So 2.3 is going to look at screening. So it says tier 2 teams use decision rules and multiple sources of data, i.e. the office discipline referrals, academic progress, those universal screening tools, attendance, teacher, family, or student nominations to identify students who require tier 2 supports. So some possible data sources include those multiple data sources, whether they are the data that comes from looking at those office discipline referrals, the data where they are tracking the time out of instruction, whether it be for in-school suspension or whatever time if a child has been removed from the classroom, the attendance of students, academic performance. Remember that teams, and if you think back to your tier 2 training, there should be a multiple data points used to identify students who are in need of tier 2 interventions. The team can use the team decision rubric that was created that would guide the process of determining who is in need of tier 2 interventions, team meeting minutes, and the school policy. So a team receives a 0 if there's no specific rules for identifying students who qualify for those tier 2 supports. The team receives a 1 if data decision rules are established but are not consistently followed or are gathered from only one data source. The team will receive a 2 if that written policy exists, and A, that uses multiple data sources for identifying students, and B, ensures that families are notified when a student enters tier 2 supports. So some considerations for item 2.3, is there a documented process for identifying students in need of assistance? Do teams use multiple data sources to identify students in need of assistance? Is there a process for notifying and including families? So 2.4 is going to look at that request for assistance. The feature says the tier 2 planning team uses written requests for assistance forms and processes that are available to all staff, families, and students. So some possible data sources is the school handbook, that request for assistance form that all teachers and student personnel have been trained to use, or that family handbook. So a team receives a 0 if there's no formal process that exists. That team receives a 1 if there's an informal process in place for staff and families to request behavioral assistance. They receive a 2 if there's a written request for assistance process is in place and the team responds to requests within 3 days. So remember from your training, when we have our tier 2 interventions, we want to make sure that these tier 2 interventions are readily accessible as soon as a student has been identified and seen as a candidate in need of tier 2 assistance. Those interventions should be able to be started within a few days of that student being nominated, and the team too going through that process to decide that that student is qualified to receive those tier 2 interventions. So some things to think about for 2.4, or that request for assistance. Has the team established a process for nominating a student that is easily understood and easily accessed by all? So again, in your training and when you're thinking about professional development, all teams, all student personnel that work in that building need to understand the process for nominating a student for tier 2. They need to understand those tier 2 interventions and what those interventions would be, as well as their role. So everyone needs to understand that, and they need to understand that process for how the team identifies students and how a teacher or a family or a parent can identify or nominate a student for those services. Do family, staff, and students know how to nominate a student and know the process of what happens when a student is nominated? Has the team established a process that allows students quick access to needed support? So again, remember, once a child has been identified as in need of those tier 2 interventions, the process for beginning those interventions should really be a quick turnaround so that that student can begin receiving those supports as soon as possible. So some things to integrate mental health, some mental health strategy is the tier 2 team should use decision rules and multiple sources of data, i.e. office discipline referrals, academic progress reports, screening tools, those universal screening tools, attendance, teacher, family, and student nominations to identify students who require tier 2 supports. Screening for social, emotional, and behavioral concerns should be present. There should be some way that teams are identifying both internalizing and externalizing behaviors. That screening should allow students to be identified early and linked to that appropriate intervention. Tier 2 planning team should use a written request for assistance form and have a timely process available to all staff, families, and students after they have made that request. The tier 2 team should promote awareness of the available interventions and their purpose. So, for instance, groups for students who have experienced trauma, as well as how to join the intervention. They should improve the knowledge of their staff about those interventions, and they should help to ensure that families and students understand how to access that help if those supports are needed and the family wants to request those supports. So 2.5 is going to look at the options for tier 2 interventions. So the feature says that the tier 2 team has multiple ongoing behavior support interventions with documented evidence of effectiveness matched to students' needs. So possible data sources include the tier 2 handbook, the targeted interventions reference guide. I'll drop a link to that in the chat box. A team will receive a 0 if there's no tier 2 interventions with documented evidence of effectiveness that are in place. The team will receive a 1 if only tier 2 intervention with documented evidence of effectiveness is in use. And the team will receive a 2 if there are multiple tier 2 interventions with documented evidence of effectiveness that are matched to the student's needs that are in place for those tier 2 supports. And again, if you haven't had the opportunity to go through the tier 2 training, then this would be an opportunity for your team to really take time to go out and understand how to match students' needs with with those interventions. It's very important that you understand the motivation behind those behaviors that that child that is being nominated for tier 2 or that has been identified for tier 2 is the motivation behind those behaviors, and then that you're matching the interventions that are appropriate for behaviors that occur due to those motivations. So some guiding questions for 2.5 is, are there multiple tier 2 interventions readily available? Again, a school building should have multiple interventions that are available because behaviors have multiple sources of motivation as well. You want to be able to have the ability to pivot and shift and match students to interventions based on their needs. Are the tier 2 interventions available, evidence-based, and have proof of effectiveness with students? So again, it is very important that whatever interventions that you have in place, that there are some tier 2 interventions that are available. And does the team have interventions that are based on the function of behavior? So there are some videos that are on the Western Ohio PBIS Network podcast YouTube channel that you will be able to use to help you understand how to match students to those appropriate interventions and how to understand the function of behaviors. So when you are looking at your 2 point this item, I apologize. One thing to do is to use this targeted interventions reference guide. This can be found in the appendix of the TFI. And so what this reference sheet is going to do is going to help that team analyze those interventions that they have in place and see if those interventions are appropriate for the possible motivations of those behaviors. And again, this can be found in the appendix of the TFI. So 2.6 is going to look at tier 2 critical features. And so this item says that tier 2 interventions provide additional instruction and time for student skill development. They are additional structure and predictability, and or C, increased opportunity for feedback, i.e. through a daily progress report or something of the such. So some possible data sources are going to be those tier 1 universal lesson plans showing that documentation that those students have experience instruction in those tier 1 supports and those tier 1 interventions. The tier 2 lesson plans that are going to be used to provide that targeted small group instruction, those daily and weekly progress reports, a school schedule or school tier 2 handbook. So a team receives a 0 if the tier 2 interventions do not promote additional instruction and time or improved structure, or there's not an increase in that specific positive feedback or that corrective feedback. The team receives a 1 if all tier 2 interventions provide some but not all 3 core tier 2 features. And then the team will receive a 2 if all tier 2 interventions are included and all 3 core features are included. So some guiding questions and consideration is, do all tier 2 interventions include additional instruction time for student skill development? Again, it's important that these interventions are reteaching those skills that they did not necessarily learn from that tier 1 universal support that they received. Do all tier 2 interventions include additional structure or predictability? So again, we want to structure this support in these interventions so that we have them scheduled on a regular basis. They're helping to provide structure inside and out of the classroom. Do all tier 2 interventions include increased opportunities for feedback? So again, remember PBIS, we use behavioral errors as opportunities to reteach. So we need to document how we are reteaching those expected behaviors to correct the behavioral errors that those students are making. And has the team established a method for tracking and monitoring efficacy of these tier 2 interventions? It's very critical that during that planning process, the team decides how they're going to monitor the students' response to these interventions and their effectiveness. So 2.7 is going to be looking at practices matched to student needs. So the item says a formal process is in place for efficient selection of tier 2 interventions that are matched to student need, i.e. behavioral function, and have contextual fit, and i.e. cultural and development level. So they're culturally responsive and they are culturally appropriate, and they are developmentally appropriate. So possible data sources includes one, data sources used to identify the interventions, the school policy, the Tier 2 handbook, the needs assessment, the targeted interventions reference guide. So a team receives a 0 if there's no process in place. The team receives a 1 if there's a process for selecting Tier 2 intervention. Does not include the documentation that the interventions are matched to students' needs. And the team will receive a 2 if the formal process in place to select students that matches students' needs and has contextual fit that is developmentally and culturally appropriate is in place. So some guiding questions or some consideration: is there a formalized process to select Tier 2 supports? Does the process take into account the student need, the function and the behavior, and the contextual fit? So some mental health integration strategies are: 1, school and community employed staff develop a single continuum of interventions that is evidence-based, matches needs in a culturally appropriate way, and increases to match intensity level and prioritizes family perspective. Another strategy is that the school and community employed staff receive professional development regarding their role in the Tier 2 critical features, including the teacher's role in providing those prompts, those pre-corrects, and those reinforcements of skills being taught in Tier 2-1 interventions, i.e. using that daily progress monitoring report to track those interventions that are being provided in the classroom, as well as how they are providing that feedback and those reteaching and using those evidence-based strategies to correct those behavioral errors. As interventions are selected through a team-based protocol, critical features are addressed specific to each intervention before implementation begins. Linkage to Tier 1 expectations and progress monitoring are clarified. So remember, everything we're doing in Tier 2 is going to link back to our Tier 1 implementation. Our Tier 2 interventions are going to support our Tier 1 support. So a student still should be receiving those Tier 1 supports that are universal and provided to all students, as well as in addition to the Tier 2 supports to try to intervene on some of those consistent behavioral errors that are happening. Decisions and selections of interventions, regardless if delivered by school or community employed personnel, are made through one team at the Tier 2 level. So that Tier 2 team is going to be responsible for determining what interventions are put in place. They're going to be evidence-based interventions. They're going to be researching those various interventions to ensure that they have some data to show that they work. Interventions are matched to how a student responds to a life event, rather because they experienced a life event. So that means, for example, if students' parents gets divorced, the student is not automatically placed in an intervention for students whose parents get divorced. Rather, students are assigned to groups based on a specific presenting and problem area where they have identified that they need those skills. So we're matching those students to interventions based on those skill deficits that we have identified in our student identification process. So 2.8 is going to look at access to Tier 1 supports. So the feature says that Tier 2 supports are explicitly linked to Tier 1 supports, and students receiving Tier 2 supports have access to and are included in Tier 1 supports. So remember, as I just said, that your Tier 2 interventions are there to support those Tier 1 universal supports. And students that are in need of Tier 2 interventions are receiving more targeted supports to help them be successful within those Tier 1 universal supports. So some possible data sources would be the universal lesson plans and that teaching schedule to show when those lessons were, those skills, those universal behavioral skills were taught, and that schedule. The Tier 2 lesson plans, a look at the acknowledgement system, if there's student of the month documentation, and any family communication. So a team receives a 0 if there is no evidence that students are receiving Tier 2 intervention, that the students receiving Tier 2 interventions have access to Tier 1 supports, are still receiving those Tier 1 supports. The team will receive a 1 if the Tier 2 supports are not explicitly linked to tier 1 supports, and or the students receiving tier 2 interventions have some but not full access to those tier 1 supports. And so, and a 2, the team will receive a 2 if the tier 2 supports are explicitly linked to tier 1 supports, and students receiving tier 2 interventions have full access to and receive all tier 1 support. So again, I cannot stress enough how important it is that before teams embark on tier 2 interventions, that you ensure that your tier 1 supports are being implemented with fidelity and that students are receiving all of those supports, because you will never know if a student truly needs tier 2 supports if your tier 1 universal implementation is not being implemented with fidelity. So some guiding questions for this item is, has the team established tier 2 supports that are aligned with the school-wide universal system? Do students receiving tier 2 support still receive full access to those tier 1 support systems? Some mental health integration strategies. All staff, families, and students are aware of interventions. They understand their role and actively participate in the intervention and encourage the transfer of knowledge of key aspects of the intervention across home, school, and community. So our team is ensuring that all stakeholders, parents, families, teachers, other student personnel understand what their role is in ensuring that these students receive these tier 2 supports. The tier 2 interventions are not just there for an intervention coordinator or a facilitator to provide. This is an all hands on deck. And so these students should be able to have the opportunity to apply these skills that they're learning in those small group targeted tier 2 intervention groups to all contexts and settings. And we should have trained everyone to be able to watch how those students are demonstrating those learned skills. Another strategy is resource mapping of current practices, programs, initiatives, includes current and potential collaborations and partnerships with community programs and initiatives. For example, the Girls and Boys Clubs, the Parks and Recreation, the library, the local mental health. So again, we want to ensure that we are using all of those resources and tools that are available to us. So we want to make sure all of our community partners understand our PBIS framework and how they could support this framework in the community, because again, we want to make sure that all of our stakeholders are engaged, they understand how they can support the mental health and the behavioral health of all of the students within the communities that they service. So 2.9 is looking at professional development. This one says a written process is followed for teaching all relevant staff the process for and how to implement each tier 2 intervention that is in place. The possible data sources include a professional development calendar, staff handbook, lesson plans for trainings, a school policy. So a team receives a 0 if no process for teaching staff is in place. They receive a 1 if the professional development and orientation process is informal. They receive a 2 if written process is used to teach and coach all relevant staff in all aspects of intervention delivery, including requests for assistance, using progress reports as an instructional prompt, delivering feedback, and monitoring student progress. So remember that there are various levels of professional development that are going to be needed for your tier 2 interventions, in addition to those professional development requirements and plans that you have for your tier 1 universal supports. So depending upon their role, they're going to need a certain level of professional development to understand their role in supporting those students that are in those tier 2 interventions. So some guiding questions is, are there scheduled trainings for school team members? Is there a faculty-wide orientation led by the tier 2 team to let the staff understand and know the tier 2 interventions that are available and how students are identified, how students are monitored, and how students are graduated from those interventions? Is there a scheduled annual orientation for new faculty, substitutes, or volunteers? Is the process for requesting assistance around behavioral concerns known by all, easy to follow, and encourage? So again, there should be a process where by a student themselves, a family member, or a student staff personnel can nominate a student that they feel are in need of those tier 2 targeted supports, and that process should be well known and very easy to complete. So some mental health integration strategies include professional development is available for both school and community staff on how to identify students who display those internalizing behavior, have those internalizing behaviors and needs, i.e. the nurses off, those students that are going to the nurse's office a lot, requesting to go to the nurse's office, those students who have poor attendance, those students who are chronically being placed in timeout or are requesting time out of class to seek a clinician. The professional development is available for both school and community employed staff on understanding function-based problem solving. So again, if you haven't had a chance to check out some of the videos on the channel, there are a few videos that are going to help you understand how to understand the function of the behavior and how to match those interventions to those functions. So 2.10 is looking at level of use. This feature says the team follows a written process to track proportion of students receiving or participating in tier 2 supports, and access is proportionate. So if you remember back into your tier 1 training and your tier 2 training, we talk about the levels of students that should be supported by your by each tier of PBIS implementation. So some possible data sources for this is that the tier 2, you can look at your tier 2 enrollment data, your tier 2 team minutes, meeting minutes, and any progress monitoring tools that you have in place. So a team will receive a 0 if the team does not track the number of students that are responding to the tier 2 interventions. The team receives a 1 if the team defines criteria for responding to each tier 2 intervention, but fewer than 5% of the students are enrolled. And then they receive a 2 if the team defines criteria and tracks proportions with at least 5% of the students in the school receiving tier 2 supports. So remember that your tier 2 supports can serve anywhere from 10 to 15% of your students. Your tier 1 supports, if implemented with Fidelity, should be sufficient to support 80% of your students. If you're finding that you have more students in need of tier 2 intervention supports, you always want to go back and look at your tier 1 implementation to ensure that that's being implemented with Fidelity, and maybe tweak some of the implementation processes and systems to ensure that they are supporting all students. So some guiding questions for this item is between 5 and 15% of the total student population receiving tier 2 supports? Remember, if we have more than 15%, then we want to go back and look at our tier 1 implementation. Does the school have the capacity to sustain effective supports for this proportion of students? So remember, not only do we want to make sure that our tier 1 program and supports are in place and being implemented with Fidelity, but whenever we embark on implementing a tier 2 interventions, we want to make sure that we have the capacity to effectively deliver these service, and that we have the capacity to support the number of students that we have identified in need of tier 2 supports. Is the tier 1 school-wide system being implemented with Fidelity? So remember, I always keep stressing this. Everything starts, the foundation of your PBIS framework is your tier 1 implementation. If that is not being implemented with Fidelity, then your tier 2 will not be sustainable, because you'll have more students needing tier 2 than your team can support and then your school can support. Does the team have a process in place to monitor students' response to the interventions? And like I said, there are some videos that are available to you on the YouTube channel that will help you understand how to monitor students' response to the intervention. It's very important that teams in their planning have a process for monitoring how well students are responding to the interventions that are being put in place. So 2.11 is going to look at student performance data. And so 2.11 says tier 2 team tracks proportion of students experience success, percent of percent of participating students being successful, and uses Tier 2 intervention outcome data and decision rules for progress monitoring and modification. So some possible data sources are going to be that student progress data, i.e. the percent of students meeting the goals, the intervention tracking tool, the daily and weekly progress report sheets, and that family communication. So the team receives a 0 if the student data is not monitored. They receive a 1 if the student data is monitored, but no data decision rules are established to alter. So there's no process in place to understand if an intervention needs to be intensified or faded. They need to be intensified because the student is showing a poor response or no response to that intervention, or if that student is showing a positive response and that student can be faded from that intervention. So the team receives a 2 if the student data or the percent of students being successful are monitored and used at least monthly with data decision rules established to alter whether or not that to intensify or fade that intervention support, and that information is shared with stakeholders. So some data, some guiding questions for that item is, has the team established a system to collect and organize intervention outcome data? Does the Tier 2 team have access to reports summarizing intervention outcome data? And has the Tier 2 team established a system that includes data decision rules to identify how students are responding to Tier 2 supports? So again, it's very important that there's a process in place to track, monitor, and make decisions about how well students are responding to those Tier 2 interventions. So some mental health integration strategies is, 1, all Tier 2 interventions, regardless if they are delivered by school or community employed members, are progress monitored for fidelity and impact through an integrated Tier 2 systems teams. So whether they are receiving intervention supports from that Tier 2 team or community partner, that data is being tracked and their response to those interventions are being tracked. School and community employed staff install interventions according to data and need. So for instance, if a large percentage of students within a building have experienced trauma, a trauma-informed intervention would be appropriate at Tier 1 versus a smaller percentage at Tier 2 of students who might receive a targeted intervention within that Tier 2 continuum. So we're knowing when a Tier 2 intervention may need to be embedded in our overall universal support. School and community employed staff are proficient at using consistent data gathering tools and processes where possible, i.e. those daily progress monitoring reports, and whatever you use to track the data from those daily progress reports. So communication systems and processes can be streamlined. So everyone knows how to collect the data and interpret the data so that they can monitor the student's response to that support. Barriers to intervention are reviewed and discussed. So we want to always be looking at what could possibly be a reason why a student is not receiving or responding to an intervention, and what we need to do to ensure that those interventions are more valuable. So 2.12 is going to be looking at the fidelity data. This says the Tier 2 team has a protocol for ongoing review of fidelity for each Tier 2 practice. So the Tier 2 coordinator, you can look at possible data sources, the Tier 2 coordinator training, the district technical assistance plan, the fidelity probes taken monthly by a Tier 2 team member. So again, it's important that the team is monitoring the fidelity of the implementation, meaning we're going and we're looking at how those facilitators that have been selected to deliver the interventions are implementing those implementations with fidelity. So we want to make sure that whatever interventions that are being implemented, they're being implemented with fidelity. So a team gets a 0 if the fidelity data are not collected for any practice. The team receives a 1 if the fidelity data is collected for some but not all Tier 2 intervention. And the team receives a 2 if periodic direct assessments of fidelity are collected by the Tier 2 team for all Tier 2 interventions. So some guiding questions for item 2.12 are going to include, is the team assessing fidelity of the implementation at tier 2? Is there regular assessment of fidelity of the intervention? So as I said, not only is that team going to be assessing their overall implementation of their tier 2 framework, they're also going to be assessing how well those interventionists are monitoring and administering those interventions to those students. And so that data should be tracked, as well as there should be some process where an intervention coordinator or someone from the tier 2 team is going out to observe those interventions taking place and using those checklists to determine if those interventions are being implemented with fidelity, because you can't really track a student's response to an intervention if the team is not tracking their overall tier 2 intervention and how those interventions are being developed and implemented. So 2.13 is going to look at that annual evaluation, just like in our tier 1 implementation. We should be producing an annual evaluation. So this one says at least annually, tier 2 team assesses overall effectiveness and efficiency of strategies, including data decision rules to identify students, range of interventions available, fidelity of implementation, and ongoing support to implementers, and evaluations are shared with staff and district leadership. As we have talked about throughout both of these videos, very important that both tier 1 and their tier 2 teams are very transparent with their stakeholders. Everyone understands how that team works and how decisions are made. So some possible data sources would be staff and student surveys from PBIS assessments, tier 2 handbook, any fidelity tools that are being used, the school's policy, the student outcomes, and those district reports. So a team receives a 0 if no data evaluation takes place. They receive a 1 if evaluation is conducted, but outcomes are not used to shape the tier 2 process. They receive a 2 if the evaluation is conducted at least annually, outcomes are shared with staff and district leadership, and clear alterations in process are proposed based upon evaluation. So if we see there's a problem, we make sure that we adjust that problem based on whatever that data really has to be what drives your implementation and lets the teams know when they need to pivot or adjust their action plan or their implementation. So some guiding questions for this item is, one, has the team established an evaluation system for tier 2? So how are you going to evaluate the efficacy and the fidelity of that program? Does the team conduct an annual evaluation of the tier 2 implementation? Are those outcomes shared with all stakeholders, meaning the faculty, the students, the family, the board members, the superintendent, all of the stakeholders? Are the outcomes clearly linked to a tier 2 action plan? So some mental health integration strategies for this item is, one, the school and community employed staff are in the process of gathering the school and community employed staff are in the process of gathering process data for identified evidence-based interventions. School and community employed staff use process and performance data to determine the overall effectiveness of those interventions. So all of those school and community people have a process that they use to monitor the performance, the overall performance of those interventions that they're putting in place. Both school and community employed staff use a similar process of gathering and analyzing data, so decisions regarding intervention effectiveness can be streamlined. So whether if there are community partners, community mental health-based partners that are within the school, those people ideally should be a part of the tier 2 team. And if not a part of the tier 2 team, there should be some interaction so that we understand how both entities are collecting data and tracking students' response to those interventions. Family and community stakeholders actively participate in the evaluation, the review, and the action planning. And lastly, the evaluation and assessment of fidelity of implementation guides decisions regarding which interventions to continue and which to remove. So again, it's very important that that data is going to be what drives those decisions on what interventions need to be put in place within your building based on the needs of the students, based on the overall needs. which students need to be matched with what interventions and how well those interventions are working. And if data indicates that those interventions are that a majority of the students are not being successful with those interventions, how do we replace those interventions with other evidence-based interventions? So thank you for tuning into this podcast. Don't forget to hit like or hit the subscribe button.